Welcome back. February is American Heart Month, which is a great time to remind us all how important our heart health is and what we can do to prevent heart disease. As the city Department of Health recently found, the Bronx has a particularly high rate of heart disease compared to other boroughs, making it a concerning public health challenge for our community. Joining us now is the Education Manager at VNS Health, Rae Talerico. Rae, thank you so much for joining us.
Thank you for having me.
So February is American Heart Month. Tell us why it is such a crucial time now to spread awareness about heart health, especially in our community.
Sure. Well, unfortunately, heart disease is really prevalent, as you mentioned, in this community, and across racial and ethnic groups, for both men and women, heart disease is the #1 killer. We notice that it's something that a lot of us can relate to, right, in our families, in our communities, and so being educated about it, really knowing what that means for you and your family and what your risk factors are is really, really important. And so some of the risk factors we think about when we talk about heart disease are high blood pressure, high cholesterol, obesity, lack of physical activity, and smoking. And just those first two, high blood pressure and high cholesterol, people don't always know that they have it. You don't necessarily feel it. So high blood pressure is sometimes referred to as a silent killer because unless you're getting frequent checks, unless you're going to all your medical appointments, it's really easy to not know that this is a problem for you. So some people can be walking around with this. I think 47% of Americans have high blood pressure and most people don't know it. So being aware, knowing that this is a problem is the first step to addressing it.
You know, I think you kind of just touched on that because I do want to talk about, the New York City Health Department found that the Bronx has a high rate of health disease. Why do you think that our borough is so impacted by this?
Sure, at VNS Health, one of the things we like to talk about and our nurses communicate with patients is that we like to look at all the social determinants of health, and that is access to healthy food, making sure people have access to transportation to get to their appointments, making sure that there's health literacy so people know what to look for in their diet to make sure that they're addressing heart disease or that they're knowing what to do to prevent heart disease, right? So it's really a combination of all of these factors. It's not just about you in a room with your medical provider. It's about taking a more holistic view of what it means to be healthy.
And you mentioned that certain groups at the top of the interview, you mentioned that certain groups are more vulnerable to heart disease, including men, women, people with diabetes, and smokers. Why exactly are these groups at higher risk?
Sure. So for people for smoking, we know smoking is a risk factor for worsening heart disease, and diabetes is as well. And so there are things that we can do. When we talk about risk factors, there are things that are not modifiable, right? So as we age, more people are likely to get high blood pressure or heart disease. We can't really do anything about that.
Right.
Sometimes there's a strong family history, a genetic component. We can't really do anything about that. But we know things that are modifiable risk factors, right? So those are the things like smoking, right? Smoking causes damage to our vessels, really at the cellular level, at a very, at the microvascular level, and increasing CO2. All of these things work to damage our hearts. And same thing with diabetes. Persistent high sugars really damage us at the level of the muscle of the heart, the level of the arteries. Can lead to plaque buildup. So these are all the things that we can work to change, right? So we can work to make sure that sugars are well controlled. There are a lot of resources to help people stop smoking if you're a smoker. So those are the things we have to focus on.
And aside from, like you mentioned, the actions that you can take yourself, family history also plays a huge role in heart disease. So what are some steps that somebody should take if they have a family history and they find out it runs in their family?
Sure. So I think the first thing is, yes, talking to your family about family history, knowing that maybe, mom or dad have high blood pressure could be a reason for you to go get screened, or high cholesterol. And then also really realizing that when we're talking about health in our families, we tend to eat like our family. We tend to have similar behaviors as our family. You know, if you didn't grow up exercising, you know, getting into those things as an adult can feel like a large challenge. So I think it's identifying that there's probably, you know, given all that we talked about the statistics and how many people this affects, it's a pretty good chance that these issues are affecting your family and also your friends. So talking about it, seeing what has worked for other people, or if, you know, also making sure to have a shared goal with your family. You know, it's harder to have just one meal for yourself and everybody else is eating something different. So if high blood pressure is an issue for everyone, making sure that everybody's coming together as a family to plan meals, to look at salt content, to really think about, you know, how as a family can we address this for all of us? Because it's just easier.
Mhm. You know, I like that. I like the idea of getting everybody involved, because even if you don't necessarily have these conditions, it still doesn't hurt to eat healthy and to plan and to kind of make that a
Absolutely.
family thing. And they always say teamwork makes the dream work. So I think that is just a fun way to do so. And it's also, I think, will lead to better results, because like you said, sometimes when you're by yourself, it's a lot harder to see
Yeah.
everybody else, you know, sitting on the side and having fun, and you're there like, okay, you
Right.
know?
And connecting with people is good for your heart, right? You know, getting out, you know, if you have someone, if you're trying to exercise more and you're trying to do that by yourself, if it's really cold outside, it's really easy to talk yourself out of it. But if you have someone else who's helping to keep you accountable, someone else that you want to help keep accountable, it helps you just maintain that habit. And that's what it's really about, right? Because we're trying to play the long game when we're talking about heart disease. You know, these habits over time are things that we want to integrate into our lives to help us maintain them over the long haul, right? And so that's about getting more physical activity in, because that's a huge issue. And that could be anything, right? So the recommendation from the American Heart Association is 150 hours a week of physical activity, which when you hear it like that, sounds like a lot of activity. It sounds like a very high number, but you can break that up any way you want. I even say to my patients, you can do 10 minutes of physical activity at a time and break that up throughout the day to make it feel less overwhelming. And you don't have to join a gym. You can, sometimes I say, you know, especially with moms with kids, you know, put the radio on and dance for 10 minutes, right? It's just about getting moving and doing something fun. Also, people can try to take the stairs when they can instead of the elevator. Or I sometimes say I recommend getting off one stop earlier on the subway or one stop earlier on the bus, so you get those steps in. And it's just part of your day, you know. You're integrating it into all parts of your day, so it's not something that you have to think, oh, okay, now I have to, you know, I have to make this extra time to work out. Or it's just integrating it into your day wherever you can in little pieces, and then it becomes a habit over time, so it seems less overwhelming. And taking breaks is also important too, though, especially when you're starting out. You know, we say exercise as tolerated. So when you're starting exercise, you know, start low, go slow, and then over time you're going to notice that you're feeling better, and that's in itself is going to start to be more of an impetus to get you out there and doing it.
See, I like that you mentioned that, because for a lot of people, when you mention this big lifestyle change, that it's like, okay, now you have to get up 3 hours earlier and carve out this time to go to the gym.
Yeah.
It is very easy to fall off the wagon after 1 week of doing so. And that's why we see a lot of times with like the New Year's resolutions, right?
Yeah.
People are doing a complete 180 on their lifestyle. And so these minor modifications do add up in the long run. So I do thank you for sharing that. And, you know, what are some minor diet changes that can be made also to improve heart health?
Sure. A big one is watching salt intake. And that's going to be really tricky because salt is in a lot of our foods, especially if we're eating a lot of processed foods or a lot of takeout. You don't know what's in the food. And so I have sometimes patients who are like, nope, I'm great. I don't add salt to my food. I don't add salt to my plate. And that's great. But if you're getting a lot of your meals prepared or you're eating a lot of takeout, there's already a lot of salt in the food. You don't have to add anything to the plate. And so really trying to cook more and really being mindful about how much salt is going into the food. Because once you see it, it's easier to make some small adjustments over time, right? And we're not saying stop completely. It's small changes, right? And your taste buds will change. It's also just reading labels, being more aware, trying to get more whole grains in your diet, avoiding saturated fats. So trying to avoid things like processed meats, full fat dairy, fried foods, and really trying to integrate more whole grains, oatmeal, fresh fruits and vegetables, beans, nuts. These are all things that we know are good for our hearts.
And I'm reading here. There's one big one I really do want to mention is stress.
Stress.
Stress is a huge contributor. Tell me, what are some ways that people can manage their stress?
Sure. For some people, look, it's really a personalized approach, right? For some people, connecting with others is, really helps manage their stress. Talking to people on the phone, connecting with your family, connecting with friends. For other people, it's about maybe things that are more mindfulness based, maybe like meditation or quiet time or solitude. For other people, it's really about making sure our sleep is right. Sleep, unfortunately, is also if people who are getting less than 7 hours of sleep are more likely to develop heart disease. So really making sure we're talking about sleep hygiene is what we call it. And what our nurses help do is help people understand what are the factors that are maybe getting in the way of them sleeping. And I know a big one for all of us is our phone or our TV, and really controlling our media content right before bed. And that hour before bed, shutting off phones, shutting off any kind of media to help our bodies relax. And that's a really big one. And as you'll notice too, if you're increasing physical activity throughout your day, it makes it easier for you to sleep. And physical activity also has been known to decrease stress levels for folks. So all of those things together really help combat stress, because it's something we all have to deal with.
I definitely have to get rid of that 1 hour scrolling on my phone before I go to bed. That's my favorite.
It's so
like
hard.
You just doom scroll for an hour.
Yes, even calling it doom scroll, it's like reading the worst news right before bed. It's not helping you.
Right.
Yeah.
Rae, thank you so much for sitting down with us today.
Thank you so much for having me.
For more information, you can visit the website at VNShealth.org. Don't go anywhere. We'll be back with more Open right after this.